Live streaming is on.
All right. Hello, everyone. Welcome back to the SEGI V-Day webinar. My name is Justin Wong, and I am from SEGI University Kota Damansara, and also your host for this session. Now, in this session, we will be talking about our very own dentistry program. All right. Have you ever wondered how is it like to study a dentistry program with SEGI University? Now, we are very lucky to have professionals here with us to talk about our programs today. All right, without further ado, let's welcome our first speaker of the day to give an introduction to our Faculty of Dentistry. Dr. Ranjana, it's your show.
All right, thank you, Mr. Justin. Hello, everyone. Good afternoon. I am Dr. Ranjana from Faculty of Dentistry, and I'm working at SEGI since 2015. So I'm here to introduce you all to the Faculty of Dentistry, SEGI University campus. So here are some of the reasons that we feel are needed for pursuing the dentistry as a profession. So as the dentist, we can restore the oral health of the patients and can transform the lives of the patients by bringing the smiles. So this profession offers a wide range of the clinical and the academic opportunities to both the graduates and the dentists at any stage of their careers. And then the dentists can shape the future of the oral health care either by engaging themselves in dental education or research. Dentistry, of course, is referred to as an art, and it requires mastery and technique unique to the profession. So you must have a very good eye-to-eye coordination and dexterity. And definitely, we can provide the benevolent care to the communities. So I welcome you all once again. So the SEGI University Bachelor of Dental Surgery is a 5-year program that aims to produce the competent, caring, and knowledgeable dental practitioners. So our first batch graduated in the year 2016, and since then, 5 batches have successfully graduated on time. Please remember the program here at SEGI is very well accredited by MQA and it is extended till 2023. So MQA is a Malaysian qualification agency. It is a regulatory body in the Malaysia under the Malaysian Qualification Act 2007 to accredit the programs provided by the higher educational institutions. And they act as the reference point for the criteria and the standards for the national qualifications. At our campus, we have a good and comprehensive integrated curriculum, and our curriculum provides the students with the early exposure to the patients and clinical training, allowing them to develop the high levels of clinical skills and knowledge. We have a very well equipped SEGI Oral Health Center at our campus. It is well equipped with the new technologies for interactive learning, skills development, and the patient education, promoting pleasant and the safe patient care. This teaching facility ensured the students having the hands-on experience to develop the necessary skills and aptitude. And one point to mention here is we have the good number of the patient footfall because of our close proximity to MRT. We pride ourselves on having a team of the academicians who are not only highly qualified but also experienced in academia, and a good number of them hold the international qualifications in dentistry. We placed a very strong emphasis on the students' interest to foster the development of the skills for the problem solving, critical thinking, and communications as we try to shape the students to become the lifelong learners. Our students are actively involved in the research and often present their research work in various conferences. They're also given the opportunities to compete in various inter-university competitions across Malaysia. We also emphasize upon the small group learning of the students to improvise their questioning, listening, and the responding skills. These skills provide the basis for the development of the teamwork and collaborative learning. This, in long term, can aid our students in the development of the communication competences with the patients as well as their colleagues. The BDS program is divided in 2 phases. The first 2 years are the preclinical phase, and the next 3 years are the clinical phase. In the preclinical phase, All the preclinical training is set in an academic environment, and it requires our students to learn the basic medical sciences and the oral sciences subjects. So obviously, this gives them a good foundation in the dentistry as well as the structure and the function of human body. In the clinical phase, the students, they are engaged actively in the interaction and communication with the patients and perform numerous clinical procedures, but that is all done under the supervision of the specialists. This is to advance their knowledge, to provide them hands-on experience, and enabling our students to develop the best kind of medical knowledge available. During this preclinical phase, besides the lectures and discussions, the students, they even get the opportunity to work in the well-equipped sim labs and the preclinical labs. In the clinical years, the students, they attend the various specialty clinics and master their skills in the holistic dental care of the patients. The photographs are the photograph of the clinic is taken before the COVID pandemic time. The learning culture in the higher education is very different from the high school. So that is why the mentor-mentee program at the same